Intersectional viral tracing was performed by infusing a retrograde AAV expressing the Cre-dependent recombinase FLIPO into lumbar executive centers of VSX2 Cre mice, followed by infusions of an AAV expressing Cre and FLIPO-dependent GFP into the thoracic spinal cord. This strategy enabled the exclusive labeling of VSX2 neurons with direct projections from the thoracic spinal cord to lumbar executive centers. Clarity-optimized light sheet microscopy revealed dense axon projections of VSX2 neurons projecting to the lumbar spinal cord, where walking execution centers reside. To determine which neurons are responsible for natural repair following paralyzing but incomplete spinal cord injury, we performed spatially and temporally delayed hemisections of the spinal cord. The first hemisection at T12 led to acute unilateral paralysis. After a week, the mice regained the ability to walk. A second hemisection on the opposite side of the spinal cord at T7 induced acute bilateral paralysis. 4 weeks following the second hemisection, natural repair enabled the mice to recover the ability to walk.
Mice received an anatomically complete spinal cord injury that interrupted all the projections from mid-thoracic neurons, as visualized with local injections of AAV-expressing turbo-red fluorescent protein. To promote regeneration, we infused a combination of AAVs to upregulate intrinsic growth programs of mid-thoracic neurons. 2 weeks later, we performed a complete crush of the spinal cord. 2 days after the injury, we infused biomaterial depots containing permissive substrate-enabling growth factors. This infusion was followed by lentiviral injections of chemoattractive molecules into lumbar executive centers. This repair strategy propelled a large number of axons through complete spinal cord lesions and into lumbar execution centers. The complete spinal cord injury induced permanent paralysis. Following regeneration, mice recovered the ability to walk. We infused an AAV expressing the diphtheria toxin receptor into VSX Cre mice, which allowed us to ablate the vast majority of VSX2 neurons located in mid-thoracic segments. Mice had regained the ability to walk after receiving the regenerative treatment. Administration of the diphtheria toxin reparalyzed the mice.